My name is Steve Walls. I'm the head of international media relations here at Sheba. Welcome to our fascinating webinar that we're going to have today, revolving around the subject of lung transplantation in the COVID era. All of us are familiar with the many challenges in the COVID era. The lung transplantation is one of them. So we have a very busy schedule ahead. We have a lot of speakers. We have a lot of interesting things to cover. So I'd like to start right away by introducing the Consul General in Toronto.
Hello, shalom. Here we are, gathered on social media due to COVID to learn about the cooperation between Sheba Medical Center and Toronto General Hospital. In these challenging days of global pandemic, our work environment has changed dramatically as Zoom meetings and webinars are quickly replacing conversations in person. The bread and butter of diplomacy is building relations between people, between nations. And I, a diplomat, miss this human encounter connection very much. But the glass is also half full. Geography is no longer an obstacle. We're about to hear from some of Israel's finest doctors as if they were sitting right here next to us. Distance is no longer a barrier, and the wonders of technology carry with them wonderful opportunities for dialogue. When it comes to diplomatic relations, it is the responsibility of governments to create the necessary legal infrastructure that is required for building bridges between nations. We see this in the making these days as peace agreements are signed between Israel, the United Arab Emirates, and Bahrain. But at a certain point, diplomats have to take a step back and leave it up to the people and organizations on both sides to find common grounds and mutual interests. Sheba Medical Center is one of Israel's leading hospitals. Personally, I don't need a reminder. You see, my father is an oncologist and he had spent most of his professional career at Sheba. My brothers and I grew to know almost every corner on the hospital's premises. Later, I was treated there, my husband was treated there. I gave birth to my 2 children at Sheba, and I can testify that Sheba is an excellent hospital. But let's put this aside. Professionally, Sheba has ranked among the 10 best hospitals in the world. Quite an achievement. A leader in research, innovation, collaboration, and groundbreaking techniques. It is also leading the national fight against COVID-19. Sheba is involved in some impressive projects with Canadian partners, and today you will have an opportunity to hear from some of the impressive people who are involved in this collaboration. We at the Consulate General of Israel in Toronto and Western Canada hosted them about a year ago and were amazed by their professionalism and devotion, and I'm sure you will be impressed as well. So, dear friends of Sheba, thank you for everything that you do for the State of Israel and for Canada-Israel relations. Thank you, Sheba Medical Team, for your dedicated work, especially these days during a global pandemic. Good luck to you, and stay healthy.
It is all thanks to our talented team of healthcare professionals who make the impossible possible. This year, we recognize always looking at the future of healthcare to innovate, enhance, revolutionize. And it's all thanks to you. Sheba Medical Center, the new city of health.
Okay, so from our end, we will be introducing Dr. Amir On, Dr. Liran Levy, Dr. Milton Sauter, and of course, Canada has its all-star lineup as well. So first, I'd like to turn things over to the MC over in Canada, to Cantor Daniel Ben-Lulu.
Bruchim Habayim and bienvenue, welcome to this extraordinary conference in these extraordinary times. My name is Cantor Daniel Ben-Lolo, and I will be your humble moderator for this fascinating conference of innovation and cutting-edge technology. Sheba in Israel has asked Sheba Canada to support, encourage, and take an active role in the Institute of Pulmonary Medicine at the Sheba Medical Center in Israel. This institute prides itself in the treatment and care of lungs and its functions. One of the many prominent doctors you will hear from today is Dr. Liran Levy. His research, which is done in collaboration with the Toronto Lung Transplant Group, is focused on rejection. He worked on cutting-edge technology in the area of lung transplants and is now heading the Sheba Lung Transplant Program. This is one of the reasons why Sheba Canada has been selected to partner with the Institute of Pulmonary Medicine at the Sheba Medical Center. Part of this incredible lineup of prestigious doctors and researchers you will hear from today will enlighten and shed some light on the amazing technology and advancement in lung preservation and lung repair, as well as innovative clinical trials that could change and preserve the sanctity of life. In Judaism, ladies and gentlemen, the preservation of human life takes precedence over all other commandments. Even more so today, in the light of the coronavirus, the religious values clearly stipulate that no other law, biblical or rabbinical, shall supersede the law of pikuach nefesh, of saving a life. In short, there is no race, religious beliefs, and ethnicity when it comes to saving lives. Actually, even to parentheses, we say that one cannot move or live in a country, city, town, even a neighborhood where there is no doctors. So doctors, wherever you are, we will find you. In the next hour, you will hear from amazing individuals who do just that, day in and day out. And this is why the Spanish and the Portuguese synagogue is proud and honored to be counted as one of Sheba Medical Hospital's many staunch supporters. Sheba and the Spanish are developing an association of exchanging ideas, support, and fundraising. So, ladies and gentlemen, without further ado, let me introduce our first speaker, Dr. Amir On. Dr. On is a graduate of the Hadassah and Hebrew University School of Medicine in Jerusalem. He completed his residency in internal medicine and fellowship in pulmonary medicine at the Tel Aviv Suraski Medical Center, affiliated with Tel Aviv University. Postdoctoral fellowship and a clinical fellowship in interventional pulmonary oncology at the University of Texas. Also a member of the faculty of the Department of Pulmonary Medicine at MDACC, and as an assistant professor, received the prestigious Physician Scientist's Grant. He returned to Israel in 2006. Dr. On has developed the Pulmonary Oncology Service and became the head of the Institute of Pulmonary Medicine at Sheba Medical Center. He's the co-director of the Sheba Medical Center Institutional Tumor Bank and initiated the first Israeli multidisciplinary conference on lung cancer in 2011. And since then, he is the chair of these annual conferences. Dr. On heads and is establishing and the evolving new lung transplant program at the Institute of Pulmonary Medicine at Sheba Medical Center. And during the first wave of the COVID-19 pandemic, he served at the Sheba COVID-19 ICU and performed multiple bronchoscopies and intubated patients with respiratory failure due to the virus. His areas of research interest are lung cancer, biomarkers, and genomics. Ladies and gentlemen, without further ado, Dr. Amir On.
Shalom, and thank you for the kind introduction. My name is Amir On, and until recently, I need to admit, I was the only Sabra, the only one who was born in Israel out of the faculty of my department. And a year ago, we recruited Dr. Levy, who was fighting with me on this, title, the Sabras in our department. So, as you heard, Tel HaShomer Sheba Medical Center is the largest medical center in the Middle East. We are excelling in numbers, but do not need to forget the people behind the title. The people, the physicians, the healthcare personnel who are making this medical center fabulous. We have more than 1,700 physicians and approximately 10,000 healthcare personnel who are working day and night to make and to try to make a challenge, to make a difference in whatever we do. And I think the Newsweek and other institutions learned to appreciate this effort and gave us second year in a row the title of one of the best 10 hospitals in the world. So what do we do? What did we do in this pandemic? We divided the medical center into two separate hospitals. It was very important for us not to forget and not to neglect all the other medical conditions. Think of patients with heart condition, patients with a stroke, patients with lung cancer. That's what I do in normal days. It was very important for us to continue observing, diagnosing, and managing these patients. And for this reason, again, we totally separated the medical center and we devoted the personnel, and they had to work in different capsules. Some of them had to work in the Corona unit and others work in the general hospital. I was working during the first wave in the Corona ICU, CICU, and as you just heard, I performed multiple dozens of bronchoscopies on these patients, trying to see whether they have other infections rather than the COVID. Nowadays, we developed a clinic that is focusing on the post-COVID symptoms that these patients have. We see young patients who did not have any other medical condition prior to the COVID, and they present with shortness of breath, with chest pain. They keep forgetting things, different symptoms that we find it difficult to combine them. But all of them find now a clinic that and team that sees them. We have infectious disease specialists, pulmonary specialists, and others, again, who are performing research and trying to help these people. That's the Corona time. In the recent year, and just prior to the COVID pandemic, we started working on the lung transplant program. We had a team of 15 people, physicians, nurses, physiotherapists, all sorts of medical and healthcare professionals who traveled to Toronto Medical Center, the best in our mind and the best in the world lung transplant program. And all of these people together were there for a couple of weeks, learning for the masters in lung transplant. Dr. Levy, who will proceed in a few seconds, and Dr. Saute, who is sitting right to me, are leading the medical and the surgical aspects of this program. So I thank you for joining us today, and I will hope that you will join us in this long journey, putting Sheba on the map of lung transplant. We're starting second in the country. We have another medical center who is now performing lung transplantations. Dr. Saute performed most of them in the other center, and Dr. Levy is now joining forces. They are joining forces and bringing a new technology to make a difference. And you will hear about it in a few seconds. Thank you for your attention.
Thank you so much, Dr. On, for your informative and also enlightening discourse and for all your work. May Hashem give you a lot of support and Hazak Ubaruch. At this point in time, I'd like to introduce to everyone Dr. Marcelo Cipel. Dr. Cipel is a staff thoracic surgeon at University Health Network and an associate professor of surgery at the University of Toronto. He is the surgical director of the Ajmira Transplant Center at the University Health Network and also and the artificial lung program at UHN. He co-developed a new method of lung preservation and donor lung repair called ex vivo lung perfusion, also known as EVLP. This method is now used clinically in Toronto and in many other centers and has significantly increased the number of transplantable lungs. During his training, he has received 13 awards, including the McMurray Award, given for the best fundamental science work by any level trainee in the Department of Surgery, and the first annual Zane Cohen Clinical Fellowship Achievement Award from the Canadian Society of Transplantation. He also achieved a large number of first and senior author peer review publications, including high impact journals such as the Science Transplantation Medicine, the New England Journal of Medicine, the Lancet Nature Com. Dr. Cipel currently holds the prestigious Canada Research Chair in Lung Transplantation from the Government of Canada, and he is the principal investigator in very innovative clinical trials, such as the use of uncontrolled donation after cardiocirculatory death for lung transplantation and in vivo lung perfusion with chemotherapy to treat patients with lung metastasis. He is a member of the American Association of Thoracic Surgery and a fellow from the Royal College of Physicians and Surgeons of Canada and the American College of Surgeons. Without further ado, please, Dr. Marcelo Cipel.
Thank you very much. It's a great pleasure to be here and speaking a few words about our collaboration with the Sheba Medical Center. Last year we started, in the beginning of last year, we started envision this collaboration together with Dr. Salte and Dr. Levy and other doctors at Sheba. And as mentioned, we have a very long history of lung transplantation here in Toronto, where the first ever successful lung transplant was performed in the world here in 1983. And since then, we have expanded this program both on the research side and also on the clinical setting. So our collaboration it's going to be happening mainly in three pillars. One of them is a research pillar that will have a collaboration, as mentioned, this method of ex vivo lung perfusion that we can recover lungs that today are not suitable for transplantation. We can put in this machine and make that lung from the donor that have infection, for example, or have poor function or too much water inside or blood clots inside. We can really repair that organ after it's extracted from the donor and make it suitable for transplantation. And using this technique, we actually have doubled the number of lung transplants we performed in Toronto over the last 5 to 7 years. So it has made a huge impact to our numbers here. So this will be one of the aspects of this collaboration, will be our team helping the Sheba team implementing this technique for their own donors in Israel. Then we have another part of collaboration, which will be the educational pillar, which will be having this exchange of trainees from Israel to Toronto and from Toronto to Sheba. We already had Dr. Levy that spent a few years here with us and now is helping to lead this program. And we hope also to send members of our team to Sheba to learn also with the expertise that they have there, which is quite unique as well and has a lot to offer to us. And then we have the clinical care collaboration, where we're going to share, and again, especially because Sheba is a new lung transplant program, although there is very experienced people like Dr. Salti there, it is a new program. So when they have some challenging patients, we are going to participate in the discussion of those and have some what we call rounds discussion about suitability for transplant and management as well. And we could even envision at some point considering some exchange in transplantation, even by moving patients. I would like to just say a few words about COVID and lung transplantation. COVID has impacted quite a bit our ability to do lung transplants here in Canada. I think it's probably the same at some degree in Israel. The main reasons why we were so much impacted, the first one is that we had a dramatic drop in the number of donors that we used to have. So just that you have an idea, last year we did 212 lung transplants here in 2019, and this year we're not going to get not even to 140 probably, okay? And the main reason for that is the number of donors have really decreased very substantially. The other thing is, of course, hospital resources have been more difficult as well. When the ICUs are full with patients with COVID, becomes more difficult to manage the other diseases. Of course, in the first wave, we were more restricted about the other services. Right now, we're trying to keep everything else running, but we have to see how things go in the next several weeks to see whether we will have the resources to keep transplantation and cardiac surgery and cancer surgery going in a regular basis. Now, there are many patients with COVID that have a very severe lung disease, and we have employed in many of them these artificial lung devices. So here in Toronto, we have treated 37 patients with these devices. This is a temporary treatment until their own lungs recover. And when the lungs don't recover, some of these patients will actually need lung transplantation as well. And although we haven't done here in Canada yet, there has been probably more than 10 cases done in the United States of lung transplantation for COVID and some in Europe as well. So this is something that does concern us on that regard. So I'd like to finish here. I just finally would like to say a few words of my relationship with Dr. Salti, because as you know, he is a very experienced surgeon that moved to Israel, I believe in 1991. And he was really the lead in lung transplantation in Israel, continues to be, but they had a very well-known program before he moved to Sheba. Was very interesting because we came from the same city in the south of Brazil. So Dr. Salti went to Israel and I came to Canada. And later on, although we didn't meet each other in Brazil before, later on we got together to restart this collaboration, being far away. And Dr. Salti tells me that he knew quite well my family and my grandparents in Brazil, which is quite interesting and emotional for me as well. So I'm very pleased to be able to continue this collaboration now going forward. Thank you.
Thank you so much, Dr. Sipel. That was very interesting, and also your work and dedication, and everyone here on the panel is humbling. to say the least. I think and I believe right now, as it stands, Dr. Milton Saute will say a few words. We'd like to invite him to come on board and say a few words. Dr. Saute.
Thank you very much. Thank you, Marcelo. It's an honor for me to join this wonderful joint venture that I hope that very soon will give the best fruits in the field of lung transplantation. My acquaintance with Marcelo also is from our school time. Marcelo forgot to tell also that his mentor in thoracic surgery used to be my mentor before him. So we are very, very close, and we join the same ideas. Just want to say a few words about the EVLP program that we are planning to start here in Sheba. That is something that we don't have yet in Israel, but we hope that with this introduction, with this new technology, we can improve the pool of donors for lung transplantation in Israel, especially in this difficult time of COVID, where the number of donors decreased more than 50% here in Israel. So with the help of our friends in Canada, we hope, and with the help of the Toronto General Hospital team, we hope to have this technology as soon as possible here in Israel. We are sending one of our fellows here to start training in EVLP in Toronto by the 1st of January. So we hope that at about the middle of next year, we will be able to have this technology here. Thank you very much.
Thank you so much, Dr. Saute. Thank you. And now I would like to introduce our final panelist, Dr. Liran Levy. Dr. Levy is the medical director of the Sheba Lung Transplant Program. He obtained his medical degree from the Hadassah Hebrew University Medical School, where he also completed his residency in internal medicine and respirology. He subsequently completed the 4-year training with the Toronto Lung Transplant Program and the Interventional Thoracic Surgery Program at Toronto University before joining the Sheba Medical Center. In his clinical time, Dr. Levy cares for lung transplant patients and candidates with end-stage lung diseases. His research studies focus on immunological and cellular mechanisms of chronic lung allograft dysfunction. I have to admit that it took me a while to get these words together, so I don't know how much the work you do is so much more difficult. So Dr. Levy, bechavot.
Before we go to Dr. Levy, I think it would be a great idea for everybody to understand exactly what goes on here with the work with Dr. On and Dr. Levy in the lung transplantation area of Sheba Medical Center. So have a quick look.
The Sheba Medical Center is both a national and global leader in scientific and medical achievements. Our efforts are aimed towards making breakthroughs and establishing the most advanced medical centers for the benefit of our patients.
The established cardiac transplant unit and the kidney transplant center are joined by our new lung transplant unit, making Sheba a national leader in the advancement of organ transplantation in Israel and throughout the region.
In order to provide the most comprehensive and advanced medical services, we've recruited Dr. Milton Saute, a surgeon with a history of hundreds of successful transplants, and Dr. Liran Levy, the medical director who was trained at the world's leading hospital in lung transplant, Toronto General.
Our most significant challenge is to increase the number of lung transplants performed in Israel. Unfortunately, over 80% of the donated lungs are found to be incompatible for transplantation.
In order to facilitate more lung transplants, we need to implement a unique technology such as EVLP. This has the potential to improve the quality of organs and increase the number of lungs fit for transplantation by almost 50%.
With your support, we can make this dream a reality and become a global leader in the field of lung transplantation. Because at Sheba, hope has no boundaries.
Dr. Liran Levy.
Thank you, Cantor Ben Lulu, for the kind introduction. My journey in the world of lung transplantation begins in 2015 when I was fortunate enough to get accepted to the Toronto Lung Transplant Program as one of the clinical fellows. And in the next 3 years, I was doing both clinical and research work with the group there. My 4th year in Toronto was dedicated to interventional pulmonology with the surgical teams, which was again quite of an experience. I was again very lucky to be appointed as the medical director of the Sheba Lung Cancer Program a year ago. And apart from our daily work seeing patients with end-stage lung diseases before and after transplants, we are facing the COVID epidemic in the last few months. I think there are some new challenges that we're facing with patients that are referred to our center after COVID-19 survivors who have an outstanding damage to their lungs. We are now working on identifying patients who cannot recover from their injury by COVID-19, and we are looking at cases that could be potential transplanted cases. I think that the main collaboration, or the main focus of collaboration between Toronto and Sheba is focused on the ex vivo lung perfusion system, which will enable us to perform more lung transplant in Israel and provide more lungs to potential candidates. I think this need is going to be more emphasized now that we have the COVID-19 survivors who are also a growing population. I'd like to thank you, the Friends of Sheba in Canada, for the ongoing support. I spent 4 years with my wife and 4 children in Toronto, and we were introduced to the Jewish community there and felt at home. It was hard to come back, but and we still miss Toronto, but I think we have a very important mission to do here. So thank you again for all your support.
Thank you so much, Doctor. And I hope that although Toronto misses you and your family, I know that we're all going to join you in Israel one day, Bezat Hashem. That's what we're looking for. So this was, I have to say on a personal note, this has been a informative, quick-paced panel that fed us so much information that I believe that your work is so worthy that on behalf of everyone here, everybody that's on the Zoom with us today, and also everybody that knows of your work, we give you chazak, chazak, v'nit chazek, many, 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 many blessings from Hashem, and may you go from strength to strength. At this point, we will open up with a Q&A, and I'm going to ask Steve if he's on the line to begin. I think we have a couple of questions that are already submitted.
Yes, and we have a few questions that are submitted, but before I jump to one or two of them, I think that in the Corona era, I want to explain to people in Canada that Dr. Miron and Liran Levy have faced, let's just say, the challenge of their careers in dealing with people who have Corona. And as you know, the coronavirus, basically, once it gets into the lungs, they're in deep trouble. And I think they've seen just about everything. And since we got our first patients here at the end of February, we're now at the end, we hope, of the second wave. I'd like to ask both of you quickly, what has surprised you about the COVID virus and the way it attacks the human lungs? And what do you feel might be the best way going forward on the medications that are out there now to try and prevent a COVID patient from deteriorating to the point where there's no hope anymore?
Go ahead, start.
Well, I think that we were surprised by the devastating damage to lungs of the COVID-19 patients who really got in trouble following their infection. Although the majority of them are either asymptomatic or have a mild disease, there is a certain percent, that around 10% of patients who develop a very severe disease to the lungs, which is in many cases requires mechanical ventilation and ECMO support. And some of these patients just develop scarring of the lungs, which will eventually need lung transplants. Amir is leading the post-corona clinic and sees much, I think, more cases than I do. So maybe Amir would like to elaborate.
So we're facing a virus that actually did not read the medical books. It does not behave like anything we knew before. And you're trying to always learn from your peers and see what happened in history. But then you find out yourself that the best way to manage this virus is to prevent it from hitting your body. So this is actually, believe it or not, is the best medication for the virus. Now, we all heard what happened with the President Trump, and I believe that he did have the virus, and we all saw what happened 48 hours after he was hospitalized. He came out as nothing had happened. So, and we do not really know what he received in this hospital. I do believe that he received high dose of steroids. Other than that, I do not have any idea. But as of today, we do not have any medication that can completely reverse the effect of the virus. The remdesivir that was recently approved by the FDA, but the US FDA, can shorten the duration of the disease, but you cannot get rid of the virus. So again, the best way to prevent is to prevent yourself from being infected. Use the mask and social distancing. These are the best recommendations that we can have for our population and for you just before the winter.
Okay. Now, during the COVID era, the hospital operated as best as it could under semi-normal circumstances or abnormal circumstances, and there were lots of other lung issues going on, as they do on a regular basis. So what do you find for the general population? Which diseases lead to the highest rate of lung transplants, and what are the new things that maybe you've discovered in the last few years that have maybe changed the way you approach doing your work?
So I think the three main indications for lung transplant today are COPD, chronic obstructive pulmonary disease, or emphysema, which is a smoker's disease. The second most common is idiopathic pulmonary fibrosis, or pulmonary fibrosis, which is a disease that is characterized by scarring of the lungs, irreversible scarring. And the third most common indication is cystic fibrosis, which following some the evolution of new therapies is actually going down in terms of the frequency of transplants. So these three indications are responsible for about 70, almost 80% of lung transplants that are being performed worldwide.
Amir?
As we just heard, some of the COVID-19 patients recover from the virus, yet there's irreversible damage to the lungs. And in these cases, we are now considering the possibility of lung transplantation. We are facing multiple moral and medical issues. For example, a patient who was hospitalized, knowing that he or she are having COVID, and then they had to be intubated. just imagine that you are intubated, waking up knowing that you have new lungs in your body. So this is a challenging time for all of us, caregivers, families, and the patients. And we're dealing with these, again, medical and moral issues, especially at this time when the number of lung donors is decreasing also in Israel.
Okay.
I have.
Go ahead. Go ahead.
Oh, Steve, can I have some people who sent me some questions. If you would like one from here.
Go ahead.
From one of our participants is asking for any of our panelists, is there any flow through from the research at the lung transplant research to more general areas of lung care and preservation? Any correlation?
Yeah, maybe I can talk a bit on that, and then
please, Rabbi.
Yeah, yeah. I think we learn a lot through this research we do for lung transplantation, and in the laboratory we're actually doing research in lung injury, right? Not only in lung transplantation, and there is a lot of overlap between many of these technologies that we are working to use for other diseases. So one good example is, we talked about the ex vivo lung perfusion now, which is a machine that treats the lung outside the body. But in fact, right now we're using that machine to treat cancer in the lungs, right? By giving, for example, chemotherapy or other treatments just to the lung without going to the rest of the body of the patient. So this is just an example where we can, have this kind of a spin-off of the lung transplant research to other areas of lung care.
Fascinating. I have one more, if it's okay, Steve, or you want to go ahead?
Be my guest.
Here it is. Would anyone on the panel like to comment on the case of Saeb Erekat's lung treatment in Israel?
I think that I would like to answer that, because Saeb Erekat is not being treated at Sheba Medical Center. Therefore, we don't want to comment on it.
There you go. Okay, thank you. Thank you for clearing this up. Okay, I don't have any more questions on this side for now.
Okay, so going forward, what would be, I understand, are there any new techniques or solutions relevant to, you mentioned COPD, it's called? Are there any, one of the questions, are there any new techniques, solutions relevant to treating COPD?
Dr. Salte, would you like to take this question and maybe talk about the bronchoscopic lung volume reduction and surgical?
Yes, in 1983, one of the previous surgeons of Toronto General Hospital, Dr. Joe Cooper, that is an Orthodox Jew, developed a new technique to treat pulmonary emphysema in special cases where the disease was not homogeneous in the lung. He created a surgery that was called lung volume reduction surgery, where he used to take parts of the lungs that were more affected by the disease, leaving more space for the areas that were less diseased to breathe more freely. This operation had a huge impact on the medicine of, especially in America, where the American Minister of Health created a net study to evaluate the consequences of this operation, because there are hundreds of thousands of people that wanted to do it. Nowadays, this operation that was very, very invasive is substituted by an endoscopy procedure where the pulmonologists, they implant valves, in the one-way valves in the more diseased areas of the lungs, and this promotes that the air that is trapped in the lungs goes out to the trachea, it's expelled, and it doesn't get in again in these more diseased areas. So this is the big innovation in the field of COPD for the patients that used to have this very traumatic operation that we used to do till around 6-7 years ago, and now is substituted by the use of these valves that are implanted by bronchoscopy.
Okay. Cantor?
Thank you so much. Yes, I have another question if we're still taking questions.
Go ahead.
Here we go. So we have a question from Sandra that's asking panelists, given that the lung donors are less as time progresses, the question is, where did those repurposed lungs come from?
Okay. Who wants to answer?
I'm not sure I got
yeah, so the lungs that we repair in the system, it comes from the same donors that we usually use to take it, right? So we were able to double the number of transplants here. As Dr. Salti said, about 80% of the donors, the lungs are not healthy for transplantation. But by using these methods that we developed, we expanded those 20% of lungs that could be used to about 50% of the lungs now can be used, right? So that's why we increased much the numbers. It's not that there were more donors, right? But we use more lungs from the same donors that always existed. But the problem with COVID was that the ICUs of the hospitals have been quite full, and so they couldn't keep managing donors for organ transplantation. They had to prioritize to take care of the patients that had diseases, right? So and that's one of the main reasons. And there are other reasons, like there were less accidents in transit, for example, and unfortunately, there was more, for example, people dying of cardiac diseases, not at the hospital, but actually dying at home because people were afraid to go to hospitals as well. And so there was a decrease in this overall donation for several reasons. Yeah, and we don't know until when that will go. It's certainly, in April, May, we went very low, and then things have picked up since until now. We are up to about 70-80% of the usual than before. But now with the second wave, we probably will see some decrease again.
Thank you. Okay.
Thank you.
Cantor, I turn it over to you regarding the Sheba Gala invitation.
Yes. Thank you so much, Lisa. I would like to, first of all, would like to thank on a personal basis and on behalf of the Spanish and Portuguese Synagogue and all its affiliates, I would like to thank all the panelists and everyone in Israel, and also Dr. Sipel, who is not in Israel, and everyone that participated, to Einat and to every single person involved in this great initiative. And on our side, Ron and Sandra Mashal, Jeremy Abitbol, and Danny Sharabani, and the many other people who are involved in this wonderful collaboration. We want to thank you. We want to thank you from the bottom of our hearts for all the work you've done and you're still doing on a daily basis. I would like at this point to invite everyone, and then it'll be a little bit more out there. We're going to do a lot of social interaction with people to make sure that they are invited to the International Virtual Gala taking place on Sunday, November the 22nd at 1 p.m. Eastern Standard Time. It will be a very eclectic and a very beautiful gala, very prestigious invitees. And we're going to do a little bit of a wonderful, and if you look at the chat, Galit just posted a www. There's a lot of information there. So please log on and come in. It's free, and it's going to be an amazing, amazing event. We're going to be singing Hallelujah from Leonard Cohen here directly from Montreal. So we invite you all to come in and sing, and we're going to have the doctors sing the Hallelujah. I'm sure that that'll be a treat.
Thank you, Chazan Ben Lolo. It has been a quick, fascinating, to the point session tonight, or morning where you are. Before I sign off with everybody here, I'd like to introduce Einat Enbar, who runs Sheba Canada, for the hard work involved in putting this together, because it's not easy to put everything together so quickly. Einat, I give the floor to you before we sign off.
Sure. So hi, midday. I guess it's not afternoon yet. Most of people on the call know me, but some are new. So my name is Einat Enbar, Executive Director of Canadian Friends of Sheba Medical Center. Less than a year, we attempt to form another chapter for Canadian Friends of Sheba in Montreal. And I have to tell you, it's been a pleasure to work with a beautiful and enthusiastic group in Montreal, heading by Daniel Sharobani and Jeremy Abitbul, Sandra and Ron Mashal, Emily Sarid, and Cantor Ben Lolo. Thank you so much for your dedication, your time, your efforts. Without you, we couldn't have a beautiful event as we have this morning. So as you see, Sheba has a lot to offer. Today, this morning, we focused on only one program in Sheba. There are so many other programs. And what I want to encourage all of you on the call or on the Zoom is to log to shebacanada.org to see what we are doing here in Canada. We are trying to do a lot of collaborations between Sheba and the different hospitals in Canada. One of them is Toronto General. A few years ago, we did a great collaboration with Sunnybrook. And, you know, it's just the beginning. We are going to have a beautiful gala in November. I invite all of you to log in and to check it out. We have a great star that will MC to host the gala, Shira Hess, which most of you I know heard or saw her on Unorthodox on Netflix. It will be a fascinating event. Cantor Ben Lulu will be a great host from Montreal, and we are lucky to have great people here in Toronto and in Montreal working together to bring more awareness to Sheba and to raise funds to support the fantastic work that Sheba does in Israel. So, Toda Rabba, thank you very much for joining us. And back to you, Steve, if you wrap it up.
Okay. I think we've said everything that we need to say. It was a quick, fascinating hour, less than an hour. It doesn't always work that way. It just goes to show you that if things are planned properly, things go by very, very quickly. So I want to thank you. I want to thank Cantor Ben Lolo. I want to thank Marcelo. I want to thank everybody who participated in this. And we hope that the people who tuned in will get something out of it. And of course, spread the word about Sheba. Have a great day.